An estimated 32.4 million people around the world today are blind, and another 191 million are visually impaired. In Africa, approximately 26.3 million people have a form of visual impairment. Of these, 20.4 million have low vision and 5.9 million are estimated to be blind. A disturbing fact is that much of this blindness can be avoided.
Before I joined Fred Hollows, I didn't know much about eye health. But now, as I go out supporting the countries and the teams, I've been able to witness the trichiasis surgery. I don't know if I called it properly, but the TT surgeries, I've been able to witness them. I've been able also to witness live the cataract surgery. I've been able to get more information about cataract, trachoma, glaucoma, and such other eye diseases. So for me, I feel it's quite fulfilling also when I go to the project sites and I meet the beneficiaries of the work that we do.
It is these shocking eye health statistics that led Professor Fred Hollows to come up with a plan to end avoidable blindness.
This doctor called me because he wanted to see eye care services being revamped within his hospital where he's managing. He mentioned it to me, said, really, I'm receiving different funds from CDC, from Global Fund, from any big donor that I know. Yes, the Fred Hollows Foundation is small, we are receiving little, but it has direct and big impact on people's life. Eye health is very important because with sight you are easily connected to the world. You can enjoy the colors, you can easily watch the smiles of people with eyes. You can be productive. That's why eyes is very important.
Through Professor Hollows' pioneering work, a lot of people's sight have been restored around the world, and in Africa in particular.
Contexts are very different, and even when we look at the foundation in terms of the whole discussion around the phases of work, there are countries where we work, like in Burundi, where the context is different. So like we have a different kind of partnership, which was more with the private sector and not necessarily with the Ministry of Health. So you'll find that that context is very different. So you need to find ways that could actually work, which is not so much of a health system strengthening approach, but more about enhancing equity or enhancing access for those who would otherwise not be able to access eye health services, especially cataract surgeries.
Delivery of eye health services remain a challenge in the East and Horn of Africa. In the rural areas where 80% of the population lives, access to eye health services is extremely limited.
Our primary beneficiaries are not accessing services because the cost is one of the key factors that is making people not access services. So we know that the government has now rolled out universal health coverage in 4 counties, and the objective of this health financing is to ride on the wave of the UHC in the country.
Though blindness is both a cause and a consequence of poverty, the benefit of eliminating avoidable blindness and visual impairment far exceed the investment required.
It's really great that we have a new strategy within the foundation, which really prioritizes and sets ambitious targets for resource mobilization and being able to do our work and get a greater impact. For us as a region, we want to be more strategic in terms of our resource mobilization by developing innovative projects that can be able to attract more funding. And this also includes tapping into non-traditional partnerships. So, for example, looking at opportunities around working within refugee setups, those are opportunities that we have not been able to tap into before.
Last year, we ventured into forming strategic partnerships. So we want to leverage on KEMRI's expertise and their research infrastructure to be able to complement the foundation's research initiatives in the country.
The foundation will continue to work with partners to advocate for more financial allocation, training of skilled workforce, and policy formulation in eye health sector among stakeholders.
The Comprehensive Eye Care Project for Ethiopia, which is really looking at engaging beyond trachoma to look at more comprehensive eye care, which is also a priority for the government of Ethiopia. We also developed a program around sustainable financing for eye health with Kenya, which essentially ensures that we reduce on the subsidies that the foundation would otherwise provide to ministries to provide eye care. So essentially tapping into national health insurance opportunities to be able to fund cataract surgeries.
In the next strategy, we are going to look at how can we replicate this model, and above all, how do we also reach these other countries with high burden to develop their capacity in order to contribute to the national CSR. So overall is how do we effectively extend our cataract services.
For us as a foundation to be able to do more to fundraise for F&E, which is the F&E within SAFE, the SAFE strategy. We know that the S&A are very well funded, but the F&E is still a major gap area. So I feel that as a foundation, we really need to amplify our voice to be able to advocate for more resources for F&E.
Of course, low resources, as always, we have low resources. We have low government investment in eye health. Eye health is always the last to be talked about. So there's no ownership.
The Fred Hollows Foundation advocacy has yielded results in terms of increased public and private sector funding for eye health.
Not only resources, the goodwill also. We be happy to see the government itself investing in eye health sector.
However, government needs to take up responsibility for eye health services in their respective countries.
Apart from getting maybe funds, because having funds only in a system that is not owning the activities, it won't be sustainable. So having the government willing to own the activities and hospitals really seeing eye problems as part of the disease that they need to treat.
We need to have a further reflection on how we can work towards having greater ownership and sustainability of programs beyond the foundation.
We are starting to look at innovation, and I'm happy that the foundation is also geared towards innovation.
In Swahili, we have a saying that says, Mwamba ngoma huvuta ngozi kwake. So what it means is that as you are making a drum, you pull the skin towards you.
The goal of eliminating avoidable blindness will be achievable if only services were made available at the right time to the people in need.